briefly go over the implications of delegation that you learned in fundamentals, because you will be having delegation questions throughout med-surg nursing as well. Okay, and then I'm going to go over the national patient safety goals, which we talked about in the perioperative lecture, but I'm going to just reiterate them, okay? So delegation, as you know, is transferring the authority that you have to a person to do a task for you. So as an LPN, you can delegate to the unlicensed assistive personnel, and the UAP cannot then redelegate the task you have delegated to them. Okay, they cannot delegate to anyone. And you must be knowledgeable about the skill level of your UAP and know what they can and cannot do. And you must also consider the condition of the patient, because you are not going to assign a task to an unstable patient to a UAP. All right. And then you are still held accountable to when you delegate a task. So you need to make sure you circle back and supervise and make sure the task was done. Okay. So even though you transfer your authority, the UAP has to willingly accept that task, and then you have to supervise and make sure it's done, follow up. All right. And the tasks do need to be within the job description of the UAP. And there's 5 rights of delegation. So the right task we talked about, it has to be within that person's scope of practice. The right circumstances, so you're not going to delegate a task to a UAP first for a patient that's unstable. The right person, the right direction and communication, and the right supervision. So the right tasks include something that can be legally delegated for a specific patient. You cannot delegate nursing interventions to a UAP. Okay, so it has to be in the job description of a UAP. Okay, so you transfer your authority to the task, but then you're still accountable. So you do have to follow up. I'll give you an example. One time I was working on a med-surg unit. It was a crazy day. I had one patient that was really going down the tube, so I was spending a lot of time with that patient. And the UAP was getting the vital signs for all my other patients. I had 8 patients, right? And so after the dust settled on the patient that was going down the tubes and I got that all taken care of, I went to the UAP and said, you know, can I have the vital signs? And mind you, this is 4 hours after she took the vital signs. Well, I had a patient that had a blood pressure of 80/40, and she did not let me know right away. So you also have to make sure your directions are clear and specific. You know, report to me right away if the blood pressure is not within limits. So that was a valuable lesson. Thank God the patient was okay. Okay, so you have to make sure you're delegating tasks to stable patients. They don't need nursing judgment, and they have the resources they need. The right person, so your UAP, you have to make sure they're competent and qualified and they've been trained to do what you're asking them to do. Like if, for example, say there was a UAP, it's their first day, they may not know how to do a glucose test, so you wouldn't be able to delegate to that person at that time. Right direction and communication, make sure you're specific about what should be done, when they should report to you, and what they should report to you. The right supervision. So you have to circle back and make sure that the UAP has done the task you asked about, but also done it correctly. And if not so, you have to give direction about how it is done correctly. Now, the Nurse Practice Act, I know you had this in fundamentals, but this defines the role and scope of practice of LPN. So like say you're going to move to another state, you would look at the Nurse Practice Act of that state, because, for example, not every state allows LPNs to give IV medications. So you have to figure that out if you're going to move to another state. And so the Nurse Practice Act sets those qualifications for licensure and explains your scope of practice, what you're allowed to do in that state. Okay, national patient safety goals. Now, I think you already know most of these, but I'm just going to say them again. Okay, so identify patients correctly. you need to always use two patient identifiers. So the name and date of birth is the most popular, but you could also use a medical record number. You could use the patient's phone number, the patient's address, but not the patient's room number. The second one, identified patient safety risks. So reduce risk of suicide. So wherever you work on your admission assessment, there's going to be some questions you have to ask that are regulatory that are targeted towards this goal. For example, when I worked in peri anesthesia in the pre-admission teaching and testing unit, I had to ask patients, do they feel safe in their home? And I had to ask them, have they ever considered committing suicide, and are they at risk now? So those are some of the questions I had to ask them before they were admitted to the hospital. Also, improving staff communication. So that means getting the information to the right person in a timely manner. Now, we have been talking about peri-op nursing and cancer care. And so, like, for example, if somebody has thrombocytopenia before surgery, you have to get that message to the surgeon because surgery is probably going to be canceled because the patient's going to be at risk of bleeding. Okay, so that's an example of getting information to the right person in a timely manner. For the National Patient Safety Goal of using medication safely, we always check the MAR 3 times before we give a medication. We never bypass the scanning, okay? You always want to use that tool and provide proper patient teaching about medications, which means when patients are being discharged from the hospital, you're going to give written information about those medications, okay? And take extra care for patients on blood thinners. Now, we talked about this in peri-op, and I know you haven't had this in pharmacology yet, so I'm just going to tell you a few things because we talked about this in the peri-op lecture. So when patients are going to have surgery, they have to stop taking aspirin 7 days before and ibuprofen, which is a non-steroidal anti-inflammatory medication. Okay, they have to stop taking warfarin. So they have to stop taking all blood thinners before surgery. So you got to take extra care of them, and so make sure they haven't taken any of those medications. Use alarms safely is another national patient safety goal. Now, you never turn off an alarm, even if it's driving you crazy. If it's driving you crazy because it's going off a lot, maybe you don't have the parameters set at the proper level. For example, if you have a patient who has a blood pressure that normally runs like 110 over 80, but your alarm is set to go off for anything under 120, your alarm's going to be going off all day and you're going to get alarm fatigue, which means you're not going to pay attention to the alarm. So make sure they're set at the proper setting so the alarm doesn't keep going off. And ensure your alarms are turned on and at the appropriate volume, so high volume, so you can hear them. Preventing infection. We talked in the peri-op lecture about always hand washing, and you always have to do hand washing. And we're going to use aseptic technique, especially in the surgical area. We talked about skin prep before surgery, right? Taking that shower 2 nights before surgery. So they take a shower 2 nights before and the night before, and they scrub from their neck down with antiseptic soap. And then preventing mistakes in surgery is another national patient safety goal. So we verify the surgical sites are marked. Now remember, the surgeon's going to mark the surgical site and get verification from the nurse and the patient that the right site and the right surgery is going to be done. And there is a pause before surgery, which is called the timeout, where they review the patient's surgery and, patient surgery, what we're here to do today, the site of the surgery, and everybody has to be in agreement before the surgery can take place. Okay, so those are just a few tips on national patient safety goals.